Assalamualaikum, Miss. How are you, Miss? Uh, Hopefully, Miss and her family will always be healthy and always happy. Previously introduce myself. My name is Dwidia Apriliani. I'm from class 2A. Okay, here I will present material from meeting 1 until meeting 15. Okay, for the first meeting, there is an material 1. Admitting patient. A patient who undergoes a hospital's admission process to receive treatment and or care. This treatment and or care is provided over a period of time and can occur in hospital and or in the person's home. For the hospital in the home patient. Procedure admitting. First, ask the patient purpose for coming to the hospital. Then, ask the patient to see a general practitioner or specialist. Then, ask the patient to take the queue and wait for the call. Then, ask the patient to show his identity. Then ask the patient to fill out a registration form and tell the patient to bring the form to the general clinic. Material to admitting patient. After I watch the role-play video from receiving the patient, accepting a patient is done by asking the patient's full name and what the patient wants to do to come to the hospital. Then, the nurse identifies starting from the patient's past illness, whether the patient has had surgery or surgery, and asks the patient whether he has a history of allergies. Finally, ask for the number of the patient's close relative. So, in conclusion, when we receive a new patient, we must identify it, starting from the name of the place of residence, the history of the disease, and so on. Material 3. Post-operative care. I think post-operative care gives care after surgery. This treatment takes place while you are in the hospital and is continued when you are discharged before doing the operations. As many maintenance questions as possible after the operation so that we can prepare in advance. Don't forget to also learn how to prevent, recognize, and respond to possible complications. During post-operative care in the hospital, the nurse will monitor the TTV and practice deep breathing to assist lung function. Once stable, you will be sent home post-operative care at home, taking medication as prescribed, getting adequate rest. Physical activity must also be maintained and gradual. Material for post-operative care. Post-operative care nursing care. So the post-operative phase which begins with the patient's admission to the post-anesthesia care unit, or PICU, and ends once anesthesia has worn off enough for the patient to be safely transferred to the appropriate nursing unit. The PICU must be located near the operating room. The length of stay at the PICU is determined on a care-by-care basis, no minimum stay. Recruitment is mandated. There are three phases of post-anesthesia care. Phase 1 is the period immediately after anesthesia. Phase 2 is continued recovery. Phase 3 is continuous care for patients who require extended observation and intervention after phase 1 or 2. The PICU nurse will receive a complicated verbal report from the nurse or anesthetist leading the patient to recovery. During the patient's stay at the PICU, the nurse documents all assessment and intervention. Patients usually remain in the PICU until their vital signs stabilize and they are able to care for themselves. Material 5. Caring terminally ill patients. How can a clinician be helpful to a patient who is terminally ill? The following are four ways in which a clinician can be helpful to a patient who is terminally ill. 1. Aid the first physiological and spiritual coping process. The consultant might ask about some of the following: life story, relationship, coping, spirituality. 2. Assess and treat psychiatric illness. Psychiatric illness is common among patients with terminal illness. Such illnesses should be identified as the treatable syndromes that they are, rather than as expected outcomes of terminal diagnosis. 3. Maximize comfort. Psychiatric illness is common among patients with terminal illness. Such illnesses should be identified as the treatable syndromes that they are, rather than as expected outcomes of terminal diagnosis. 4. Treat the treaters and family members. Psychiatric consultants can help treaters to identify their grief and can encourage them to share this feeling of loss with the patient, with other colleagues, and with supervisor. Psychiatric consultant can also help family members cope with the impending loss of a loved one. In considering the emotional state of a person with terminal illness, it is often helpful to consider the effects of the family members on the patient and vice versa. Material 6. Caring terminally ill patient. Caring of terminally ill patient, concept of loss, grief, grieving process. Concept of loss. Life is a series of losses and gains. Everyone experiences losses at various stages in their life. The goal of nursing focuses on how maintenance and how restoration during any loss condition. Concept of loss: a person experience loss in the absence of an object, person, body part of function or emotion that was formerly present. Loss is a necessary part of life and grief is a natural part of the healing process. Type of loss: 5 categories of loss. 1. Loss of external objects. 2. Loss of a known environment. 3. Loss significant others. 4. Loss of aspect of life. 5. Loss of life. Other classification loss. 1. Actual loss. 2. Perceived loss. And 3. Anticipatory loss. Mastery 7. The district nurses. District nurses care general nurses who maintain care in the community. The district nurses' role is to provide care to stay-at-home patients by making regular home visits. During home visits, the district nurse has several responsibilities such as wound management, treatment, support, rehabilitation, assistance, and catheter care. The district nurse can also act as a teacher, knowledgeable about various aspects of healthcare. Community nurses are registered nurses who have undergone undergraduate training as a specialist. Community nurses have four key aspects of nursing, including clinical nursing, program care and management, clinical practice development, and clinical practice leadership. Community nurses can provide important information to family clients and their caregivers just like a district nurses, while emergency support may also be needed in the case when the patient has suffered a heart attack or stroke. The difference between community nurse and district nurse is minimal, while in some cases the two roles are almost identical. Material A is mid-semester. Material 6. The district nurses. I think nursing is one of the greatest professions in the world. They do such a valuable job but get paid less than politicians. Governments need to do more to help nurses. We can't afford to treat nurses so badly. Material 10. Helping patients with rehabilitation. I think the rehabilitation nurse is a nurse who specializes in helping people with disabilities and chronic illness attain optimal function, health, and adapt to an altered lifestyle. Rehabilitation nurses assist patients in their move toward independence by setting realistic goals and treatment plans. They work as part of a multidisciplinary team and often coordinate patient care and team activities. Rehabilitation nurses may practice in a variety of settings, including hospital, inpatient rehabilitation centers, outpatient rehabilitation centers, long-term care facilities, community and home health settings, insurance companies, private practice, school, industrial health centers. Material 11. Helping patients with rehabilitation. First, CPI rehabilitation therapy is meant to stimulate recovery to help the patient adapt to the sometimes inevitable sequelae or lasting effects and to foresee complications. An entire team of healthcare professionals work with the patient, doctor, nurse, and nurses, aid physiotherapy, occupational therapists, speech language pathologists, neurotherapy, psychologists, social worker, dietitian, and physical education teacher. Although this film presents a specific patient, each case is different. A multidisciplinary team defines the stroke rehabilitation program goals in the first week following the patient arrival. The physiotherapist helps the patient recover as such mobility as possible. They quickly work on her capacity to walk and continue throughout the recovery process. Each patient participates in rehabilitation activities several times a day. The rate and intensity of tests. Physiotherapy UTK activities are adapted to the patient needs and ability. The occupational therapist visits the patient home to analyze how it can be adapted and made safer, in particular through the use of accessories, when usually a support handle to help you get in. It has to be drilled into the wall to make it safe. The social worker explains the administrative, social, as insurance issues to the patient and her family. She also acts as liaison between the patient and the various support groups. She will work with when she leaves the hospital. Material 11. Mobilizing patient. In this scenario, the nurse continues to care for the patient by helping him from the bed to the toilet seat and helping him to take a shower. Because the patient has had surgery on the spine and he feels anxious and uncomfortable to do anything, it is difficult to move. The nurse explained that yes would help her to sit on the bed and get her out of bed. The nurse gave some sandals and shoes so you didn't slip. The nurse also brings up the toilet seat by slowly applying the brakes. The nurse helps her to take a shower. So in that scenario, the nurse can assist the patient's recovery after spinal surgery by mobilizing the patient using a toilet seat or wheelchair. Material 13. Medical imaging. I can conclude that medical imaging is a number of different technologies used to image the human body in order to diagnose, monitor disease gradations and treatment or for the treatment of certain diseases. Each type of technology provides different information about the part of the body that is problematic. Some of the medical imaging treatment: breast imaging, CT intervention, molecular imaging, MRI, nuclear medicine, ultrasound, X-rays. Material 14. Helping patients with diabetes management. I think several factors can affect your blood sugar levels. Food. Eating healthy is the foundation of a healthy life with or without diabetes. But if you have diabetes, you need to know how food affects your blood sugar levels. It's not just the types of food you eat, but also how much you eat and the combination of the types of food you eat, which must be done. Learn about carbohydrate counting and serving size. Make every meal balanced. Coordinate your food and medicine. Drink sweetened with sugar. Sport. These factors work together to lower your blood sugar levels. The heavier you work out is, the longer the effects will last. But even like activity, such as homework, gardening, or standing for long periods of time, can raise your blood sugar, which must be done. Talk to your doctor about an exercise plan. Create an exercise schedule. Check your blood sugar levels before, during, and after exercise. Stay hydrated. Treatment, insulin, and other diabetes medication are designed to lower your blood sugar levels. When diet and exercise alone are not enough to manage diabetes, but the effectiveness of these drugs depends on the timing and size of the dose, which must be done. Store insulin properly. Report the problem to your doctor. If your diabetes medication cause your blood sugar levels to drop too low, or if they are persistently too high, be careful with new drugs. Sometimes alternative medication may be recommended. This is when you are sick, your body produces stress-related hormones that help your body fight disease, but can also raise your blood sugar levels, which must be done. Plan ahead, work with the healthcare team. Continue to take your diabetes medication. Stick to your diabetes meal plan. Drink lots of water or other fluids that don't add calories, such as tea. Material 15. Helping patients with diabetes management. Keeping your blood sugar levels within the range recommended by your doctor can be challenging. That because many things make your blood sugar levels change. Sometimes expectedly following are some factors that can affect your blood sugar levels. Food healthy eating is cornerstone of healthy living, with or without diabetes. But if you have diabetes, you need to know how foods affect your blood sugar levels. It's not only the type of food you eat, but also how much you eat and the combination of food types you need. Learn about carbohydrate counting and portion size. A key to many diabetes management plans is learning how to count carbohydrate. Carbohydrates often have a biggest impact on your blood sugar levels. For people taking mealtime insulin, it's important to know the amount of carbohydrates in your food so you get the proper insulin dose. Make every meal well balanced as much as possible. Plan for every meal to hold a good mix of starches, fruit and vegetables, protein and fats. Pay, pay attention to the types of carbohydrates you choose. Coordinate your meals and medication. To little food in proper proportion to your diabetes medication, especially insulin, may result in dangerously low blood sugar. Hypoglycemia. Too much food may cause your blood sugar level to climb too high. Hyperglycemia. To talk to your diabetes healthcare team about how to best coordinate meal and medication schedule. Medication, insulin, and other diabetes medication are designed to lower your blood sugar levels when diet and exercise alone aren't sufficient for managing diabetes. But the effectiveness of this medication depends on the timing and size of the dose. Medication you take for condition other than diabetes also can affect your blood sugar levels. Okay, Miss, it's finished. Widya Apriliani presenting the material. Sorry if there are still so comments. I hope Miss like it. Thank you, Miss. Wassalamualaikum warahmatullahi wabarakatuh.